Hello everybody, this is Dr.M, the Inner Medicine. Today in our channel we are going to see about a common disorder of the brain, that is the depression. We all wrongly think that we can control our brain, but it is not true. Actually the brain controls us. See, your brain, that is the mind, is the boss of our body, as I told you before in Uniqueness of Psychiatry video. Once the brain is depressed, it is equal to your body without life. There won't be any energy in us. People often confuse routine sadness with major depression. So how does routine sadness differ from depression? See, both are valid emotions, but routine sadness can be fixed by friends or having fun with friends or going out. Routine sadness is just a reactivity of the mood. When something happens bad, we just feel bad for some time and then you will be able to overcome from it. Whereas in depression, it is very severe and you feel very low and nothing can fix it. People can understand only when they experience it. It is very difficult to explain about depression. To quote Sylvia Plath lines from the book The Bell Jar, see, she has told, "Wherever I sat, on the deck of a ship or at a street cafe in Paris or Bangkok, I would be sitting under the same glass bell jar, chewing in my own sour air." These are her lines from the book The Bell Jar, which clearly depicts the depression that isolates you from what you love, and it also tells you that the environment cannot fix it. Now, we will see why we chose depression. Because 30 to 40% of people in India suffer from depression. Majority of the age group which belongs to depression is from 15 to 35 years. That is 70% of the population is less than 35 years old. So, if we don't talk about depression now and if we are not aware and if we are not getting it treated by talking with an expert, this can create an epidemic like corona. There are two types of depression. One is endogenous and the other one is reactive. Endogenous, we say like it comes all of a sudden out of blue with no precipitating factors or with no triggering factors or no reasons. All of a sudden you feel depressed and you won't have energy to do anything and it will be very difficult to bounce back. Whereas this reactive depression, it can be due to any failure like love failure, I am meaning a true love here, love failure or exam failure, job failure or your financial loss, a marriage failure, anything can cause a depression. At least 2 weeks you need to have persistent sadness and you should not be able to overcome that feeling. And only then we call it as depression. You will all know about the famous actress Deepika Padukone. She is the brand ambassador of Indian Psychiatric Society and she has gone public and she declared about her depression in 2015, how she suffered from depression and how she got recovered from it. When she recovered, she started Live, Love, Laugh, an NGO for helping people with depression. The crying spell is seen in the video even after 1 or 2 years when she talks about her depression. We will watch that scene now.
Maybe I just feel better just getting away. Again, when I was out and about and with people, I'd feel okay. When I came back to my room, I wouldn't feel okay. You know, there were days when I'd wake up and feel like it was just too exhausting. You know, it was just too exhausting. I didn't want to wake up. There were days where I just wanted to be in bed, just sleep, not wake up.
It's difficult to talk about, isn't it? And I'm sorry, we don't want to upset you, but it is that intense that even today it will bring these tears.
It's definitely scary. I mean, and I think that's why I'm doing what I'm doing, because it's been so hard for me that I don't want anyone else to go through it.
Now, what is reactive depression? Reactive depression comes as a reaction to a stressor in life. The stress can be either a job stress or a marriage failure or a love failure. So now we saw about depression, how common it is. Gender wise, it is more common in women. Why women? Why do women become more depressed? There are a lot of factors contributing to it. Biologically, their brain is more empathetic and altruistic. So they give importance to needs of others and they don't take care of themselves. And biologically, as we all know, They have hormonal cycles, their periods. Culture-wise, especially in Indian culture, cultural factors like doing multiple roles. Despite being an earning partner, they are taking care of the children. The fatherhood is slowly improving now, in the sense the current generation males are slowly evolving in their fatherhood to support the females. Now, what about men? They also get depressed, but they don't get depressed as common as women. What do they do? What do men do when they become depressed? Number one, they isolate themselves. And number two, they become angry and they become more irritable when they are feeling depressed or when they get depressed. And they use alcohol as self-medication to combat depression. This is not healthy. This should stop. Another Kannada movie, Diya, the hero has reactive depression. He feels guilty for his mother's death, so he ends his life tragically by standing on the railway track.
ದೇವ್ರೆ, ನಮ್ಮಮ್ಮನ ಸಾವಿಗೆ ನಾನೇ ಕಾರಣ ಆಗ್ಬಿಟ್ಟೆ. ಅವಳು ನಂಗೆಲ್ಲನೂ ಹೇಳ್ಕೊಟ್ಲು, ಬಟ್ ಅವಳೇ ಇಲ್ಲದೆ ಬದುಕೋದನ್ನ ನನಗೆ ಹೇಳ್ಕೊಡ್ಲಿಲ್ಲ. ನನಗೆ ನೆಮ್ಮದಿ ಬೇಕು, ಪರ್ಮನೆಂಟ್ ನೆಮ್ಮದಿ. ಐ ಥಿಂಕ್ ಅದು ನಂಗೆ ಸಿಗೋದು ಬೇಡ್ಕೊಳ್ಳೋದು ಒಂದೇ, ದಿಯಾನ ಯಾವಾಗಲೂ ಸಂತೋಷದಿಂದ ನೆಮ್ಮದಿಯಾಗಿರೋ ಹಾಗೆ ನೋಡ್ಕೊ. दिया,
This is a heartbreaking scene in the climax of the movie. Consulting an inner medicine expert can avoid tragic ends in people's lives. Before closing the video,
normally when we have a small problem like say a swollen finger or a toothache या normal सर्दी खांसी, तो हम लोग क्या बोलते हैं? अरे यार, go see a doctor. If someone says, अरे I'm feeling too low, I'm feeling too depressed, यार आज mood नहीं है, तो हम लोग क्या बोलते हैं? चल यार दारू पीते हैं. And the worst thing is, get some action tonight, यार, you'll be fine. The problem is, we don't give importance to mental health as much as we give it to physical health. हमारी बॉडी को कोई प्रॉब्लम हो तो हमारे पास हर चीज का सोल्यूशन है, लेकिन अगर किसी को मेंटल हेल्प की जरूरत हो, which I strongly believe that we all need at some point in time, तो हमें पता नहीं होता कि करना क्या है, और अगर पता भी हो तो we don't do anything thinking यार लोग हंसेंगे. This is where we would like to come in. We want to make sure that we not only have easy access to help, but we have to fight this taboo of seeking this help.
with that, I close this video with a positive message that the strong ones are those like Deepika Padukone who stood up against depression and transformed themselves and changed the world's view about depression. So be bold, stand up and seek help by talking about your depression if you have any. Depression is a stepping stone for a positive transformation and a better life. Thank you from Dr. M, the Inner Medicine. Thank you so much. Please do like, share and subscribe to our channel. Thank you.